Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. I'm Bryce Patton, here with the brains of the operation, Sid Roeder. How are you this morning?
I'm doing well. Don't call me the brains.
Oh, you told me I had to listen to you, and that's always the person with all the brains. How's everything going? Good?
Wonderful.
That's excellent.
How about you?
Excellent. This is fantastic. Well, we have a wonderful guest we want to get to, Heather Allred with Pine Dermatology. We'll get to her in a second, but do you want to lead us off with our sponsors before we get into it?
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family member, and really anybody who cares. And if you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. Or lastly, if you have any suggestions for the show, any guests you would like to see us invite, you can reach me personally at 435-512-6406.
Oh, I'm so glad you do that for me. I really am. Well, excellent. Let's get into this. Heather, welcome to the show.
Thank you. It's great to be here.
Yeah. Well, so I've known you for a while, but for our listeners, you want to introduce a little about yourself?
Sure. My name is Heather Allred. I'm a physician assistant. I work at Pine Dermatology. That's in Providence, Utah, and I've been working there for a little over a year, and I've been working in dermatology for over 15 years.
Mm-hmm. Now, I met you. You practice other places here in the Valley, right?
I do. I also own a lab. It's called Cache Valley Labs Direct, and my husband and I run that lab, and it's a great place for people to go get their labs drawn.
Excellent.
Well, this is exciting. So, dermatology, the skin. Tell me a little bit. I know there's a lot of things I'm still learning. When it comes to seniors, are there any specific things with the skin that stand out to you that you might look out for?
For sure. I would say the bulk of the patients that I see are seniors over the age of 65. And what I'm seeing most of this age group for is for skin cancers, for skin checks. A lot of people think, hey, I don't go out in the sun anymore, but most of the sun damage has been done 10, 15, 20, even 30 years ago. And so it's accumulative. So we'll see this population and even younger patients for skin checks and skin cancers. But dermatology is all encompassing. You know, we look at hair, nails, the skin. The skin tells a lot about what's going on. You can see rashes on the body that indicate an autoimmune disease. So we see a lot of external features or things going on the skin that indicate an internal complication. So it's a fascinating world.
Oh, that is super interesting. Now, my question is, with the skin, can you do anything with my face and make me look better?
I don't know. You already look fantastic, so
yeah, right.
I don't know if we can get much better than that.
Yeah, well, with the skin, how, what do you look for? You're seeing people, you're saying, with skin cancers and things like that. What does that look like, or what should people be looking out for?
Good question. You can always look on the internet or in books, and you'll see these pretty nasty, scary pictures of what skin cancer looks like. And a lot of it can look like that. But interestingly enough, 30% of skin cancers don't even look like skin cancers. So I'll tell patients or my friends and family, I tell them, you should be checking your skin at least once a month. And if you notice anything new, anything growing, anything changing, something that you're picking at, something that's bleeding, something that's tender, you really should get it checked out. Come in and we'll look at it. And if you have any questions, come in. Some of my favorite stories are of patients that will come in and say, hey, I've had this bug bite for 10 years. Well, bug bites don't last for 10 years, right? And so if something seems like it's out of the norm, then you probably should get it checked out. Skin cancers don't always look like skin cancers. 30% of skin cancers don't even look like skin cancers, which can be the scary part.
So what if somebody wanted to, because they don't trust themselves or they don't know what's on their back, do you offer a preventative body scan type thing that somebody could come in maybe twice a year and say, can I just have you look me over?
Definitely, for sure. We recommend if you have any questions, come in. We can do a complete head-to-toe skin check. And after I do a skin check, I'll tell you my recommendations. Hey, for your skin type, if you have lighter skin types, we need to see you more frequently, depending on your history of how much sun exposure you've had. All of these things can indicate how frequently you need to come in. So come in at least once a year, depending on your age, obviously, and your history, but start at least by coming in for a skin check, and then we can chat about your specific circumstances, your family history, what you've seen on your skin. I would much rather a patient come in and show me a spot and I say, yeah, that's fine, than, hey, I've had this mosquito bite for 10 years. It ends up being this big, huge mass of a nasty skin cancer that leaves a really not so great looking scar.
Oh, wow. So since dermatology is a specialty, do you need a different doctor's note recommend, or can I just call you guys directly to get an appointment scheduled?
You can just call us directly. There are very few and far between insurance companies that require referral. And when you call, we'll always ask who your insurance is, and then we can tell you if you need a referral or at least point you in the right direction. In regards to a screening for insurance purposes, there is no quote-unquote screening for a skin cancer. It's just considered a regular office visit. We in dermatology consider it a screening. It is covered by your insurance. We do have some patients concerned saying, hey, I can't come see you more than once or twice or 3 times a year, whatever it is, because my insurance considers it a screening. There is no screening code for dermatology like there is for pap smears and mammograms and colonoscopies. Those are all screening codes that your insurance only covers a specific amount of those screenings every year. For dermatology, that's not the case.
So really quick, what are some of the treatments here on skin cancer? Because I've seen some of my acquaintances come back with their face being burned and things.
That's a fantastic question. It just depends on what type of skin cancer it is, how deep it is. Some of the treatments can be as basic as using a chemotherapy cream that you apply for several weeks that kind of destroy those atypical cell structures, clear to being aggressive of doing Mohs surgery, which is a type of surgery that we do at our office. We have a Mohs surgeon named Corey Mon. Or you can do radiation, or you can do excision. It just depends on the location and what's going on with that skin cancer, how deep it is. If there's metastatic suspicion, we might be sending you down to the University of Utah. So lots of different options.
So do you take samples then to identify the cancer? How does that work? Really quick.
We sure do. So as soon as a patient comes in, there's a suspicious lesion. We'll do a little biopsy, send it off to pathology. We get those results in 1 or 2 weeks. And then if it ends up being atypical, then we proceed from there and do whatever type of procedure we need to get rid of it.
Thank you, Heather. We're already at the end of our first segment. When we come back, we're going to make sure that we get your contact information for our listeners. So if you want to get a pen and paper ready in case you do have some concerns and want to contact Heather, that would be a good time. Again, let me say we are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com. This is the Senior Moment Show. We'll take a short break. Stay tuned. We'll be right back.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the Valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you. It's
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
And welcome back to the Senior Moment Show. We've been having a great conversation with Heather Allred at Lone Pine Dermatology. Real quick, before we ended, we didn't get your contact information. Would you mind sharing your contact information and how they can get a hold of you or schedule an appointment?
Sure thing. So I'm located at Lone Pine Dermatology. The address is 517 West, 100 North, Suite 103, and that's in Providence, Utah. A quick way to find us or to think of where we're at, if you go to Macy's, we're directly in front of the store across the street. So east, we're right in the same area as the movie theaters. And if you remember where Iron Gate Grill was, that's where we've built out. So pretty easy to find.
And do you have a phone number as well?
I sure do. Thank you. It is 435-554-8442.
Excellent.
Thank you. So we've talked a lot about that nasty C word that nobody wants to talk or think about. Let's talk a little bit, Bryce was mentioning, even though that's not his problem, about skin aging. That's more my problem. You probably have some good advice on skin aging, what can be done, what can't be done.
We sure do. And just by looking at the market, looking at all the creams and the different ideas for skin anti-aging, it's a multi-trillion-dollar company. The products out there, there's so many, and lots of people spend lots and lots of money. So besides doing a facelift, which the majority of people don't want to do, they want to do something that's less invasive. There are a lot of different options. Over-the-counter products, any pretty much anti-aging product probably has a retinoid in it. Retinoids are used for multiple things. They're used for fine lines and wrinkles and overall complexion. They're also used for acne. And the things that you can buy over the counter are much less or lower strength than what you can get prescription-wise. And a lot of the times if you come into our clinic, we can give you a prescription and send it through a specific mail-in pharmacy that's it's substantially cheaper, it works better, and it works by overturning the skin rapidly. And so it generates new growth, and it helps with that aging process. But before you even start down that lane, first and foremost, you should be wearing sunscreen. If you are not wearing sunscreen, don't worry about wasting your money on anything else because you're just canceling out the effect. So you can come in and chat with us about that. We have Botox and fillers, and then we have, people say, I don't want to go that route. I don't want to be injecting things into my face. If you do, great. We're happy to help you there. But we have also several procedures. We have 2 great estheticians that work at our clinic, Hallie and Whitney, and they're phenomenal. And we do anything from laser treatments to microneedling to chemical pills to facials, which are phenomenal. We also have CO2 lasers, which can resurface the face. And we even have some new devices, things that are called, one is called Elicor, that helps to tighten the skin and gives you some of the benefit pretty close to a facelift without the cost or the downtime. So lots and lots of options. Might be kind of confusing or sound confusing. I would say first start with a sunscreen. You want a sunscreen with a 30 to a 50 SPF minimum, broad spectrum, UVA and UVB. And everybody says, what's the best sunscreen? And I always reply, the one you're going to wear. So make sure you have a good sunscreen and make sure you reapply. I have you'd be amazed at how many people I have. Just off the top of my head, I had a rancher come in the other day and he said, "Oh, I apply my sunscreen." I said, "How many times a day?" And he said, "Once. That's all I need." And I said, No. You need to be reapplying your sunscreen multiple times a day. Every 60 to 80 minutes, if you're towel drying off, you're in a swimming pool, you're sweating a lot, and you get out and towel dry off or sweating it off, make sure that you're reapplying frequently. And there's lots of sunscreens, anything from sprays to mousses to creams, and one of my favorites are powder sunscreens. And powder sunscreens are fantastic. They come in a brush. They don't expire, even though they say they do. You can pick some of those up over the counter. We do sell some at our office. It's one of our hot points for selling, and you can even get some of those powder sunscreens tinted so that they kind of match your skin tones if you're fairer or darker. So some great options.
So that just brought up another question, because your sunscreen discussion reminded me, we found out when my kids were smaller that if the sunscreen had oils in it and they went into a chlorinated pool, they would get some kind of a sun allergy rash type thing.
Yes, that can happen. There are certain ingredients in sunscreens that some people can have allergies to, and some of the chemicals might give you an irritation, an irritated dermatitis or a contact dermatitis, we call it, and or if it reacts with certain chemicals. You also have to be careful if you like to be out in the ocean and snorkel and dive. You want to make sure you're using sunscreens that are safe for the environment as well. So something to keep in mind.
Now, all of us have different skin. Like, if you're concerned about what's best for your skin, can you guys make that recommendation?
We for sure can. We can help with that. Also, if you come in, we have a lot of pharmaceutical companies give us samples of their products. And I know just myself going to the store and buying a product, you're spending anywhere from a few dollars to several $10, $20, $30+ on these products, and if you use it once it doesn't work, or if you have a reaction, it can be very frustrating. And so we have a lot of samples at our disposal that if you come in for office visits and ask, "Hey, do you have samples of sunscreens?" we can give you those that you can try out to see if they work before you go spend the money.
That's great to know. I married a redhead, and I have little redheaded boys, and so we're always curious about what's the best stuff for their skin, because they're pretty fair. So.
Yes, and redheads tend to have more sensitive skin.
Boy, do they.
And they do. So you want to use free and clear products, things that don't have any fragrances, parabens, lanolins even. So you just want to be careful and use more sensitive products. But having that sensitive skin, I always tell my ginger patients that I think they have a more sensitive soul too.
Oh, that's nice. There you go.
You beg to differ?
I'm going to have to go look at this. Actually, I think that concurs with what's going on in my house. So, yeah.
Oh, there you go. Now I need to be more gentle with you, right, Bryce?
No, I'm okay.
Yeah.
I'm okay.
But this actually brings another question to my mind. Do you do those skin allergy tests where you prick?
Good question. When we talk about allergy testing, there's lots that goes into allergy testing. So you can do blood work to check for specific foods. You can do prick testing that can test for other allergies. And then there's patch testing that usually checks for things that are coming in contact with your skin. I have done patch testing quite a bit in the past at other offices I've worked at, and currently we're in the process of getting patch testing in our office. So, yes.
Okay, that's great. We're already coming up on the end of our show again. I mean, not the end, but the end of the second segment. Almost tripped myself up there. So let me mention our sponsor one more time, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, again, if you'd like to reach me for suggestions, you can reach me at 435-512-6406. We're going to take a short break. Stay tuned. We'll be right back.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks.
These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
And welcome back to our Senior Moment Show. We've been having a great time speaking with Heather Allred at Lone Pine Dermatology. In the break, we were talking about, well, again, my face and how we can make it look better, but droopy eyelids was brought up. So tell me, what can you do stuff for droopy eyelids?
Yes,
there?
We sure can. It's called a blepharoplasty, and what that means is we surgically can remove part of the upper eyelid. You can also do the lower eyelid, but a lot of our faces as we mature, sometimes those eyelids start to sink down, and not only do they impede women being able to put on their makeup because they can't put their eyelash mascara on, but also they have a hard time seeing. And Dr. Corey Mon, who is also, he owns Lone Pine Dermatology, he does those surgeries. And he does a fantastic job. He actually did mine. I had mine done. My mother needed a blepharoplasty, and she went down to the University of Utah, and she was put under anesthesia completely. It cost her an astronomical amount of money, and I knew I was heading that direction. I couldn't put my mascara on, and I decided I wanted to take care of it sooner than later. And so Dr. Mon did my blepharoplasty. He did a phenomenal job. He just did it in the office. There wasn't a lot of downtime. It was fantastic. He's also our Mohs surgeon, which means Mohs surgery is a type of surgery that is used to take care of skin cancers, specifically on certain locations in the body, like on the face, the backs of the hands, the front of the shins, places where you don't have a lot of real estate in the way of skin, and places that we want to be very conscious of scars. So what that means is he'll take out the skin cancer, immediately go look at it underneath the microscope. If it's not clear, then he goes and cuts more out, does this back and forth, going between cutting it out, looking at it under the microscope. Once it is clear, then he uses plastic surgery techniques to close it. I believe he's done over 15,000 of these surgeries. He's phenomenal. The scarring looks amazing that he does. After a year, you can hardly even see the scars. So highly recommend him to do those surgeries for you.
Thank you, Heather. We wanted to sideline too. You own another company. Let's talk about that.
I do. It's called Cache Valley Labs Direct. I started it with a partner, my husband and another couple, because we have such high deductibles that I had a hard time getting my labs drawn. I went and got my labs drawn. It was $600, and I had to pay it all out of pocket because my insurance didn't pay for any of it. So we started this lab initially to help people that have high deductibles, people that want to pay cash for their labs. And it's been a great resource for Cache Valley, for people to be able to dictate what they want, when they want it drawn, and for a very affordable price. The price of these labs usually is less than half of what is charged to insurance. It's come in, you can choose whatever labs you want, and then we draw them for the price you pay right then. We also do accept insurance, so those of people who have insurance, who have great insurance, sometimes Medicaid or Medicare, they can come in and also use our lab facility. And it's a $30 lab draw fee for that. People really love it because they can set up appointments or they don't need to. We are located right by Planet Fitness there in south part of Logan. And people say it's a great atmosphere, and the lab results get sent to you. They can also be sent to your primary care. And one thing that we also offer that we're starting to do is our mobile lab service. And so if you're not able to come into the lab, you don't feel comfortable, whatever reason, if you're sick, you want your labs drawn, you can call and set up an appointment, and we can send somebody out to your house to draw the labs. So lots of great services. We have over 9,000 labs that we draw. If it's anything from saliva to blood to stool to urine, we probably have the test, and we can help you out with that.
Wow. So what kind of labs, what kind of things are you drawing labs for? I mean, I feel like I'm a pretty healthy guy, so I haven't really had to dive down that road very much. But what maybe the most labs you see, or what they're for?
Some of the most common labs that we see for quote-unquote healthy individuals, such as yourself, Bryce, is people coming in wanting to know what their hormones are, wanting to know what their electrolytes are, wanting to know what their thyroid is, want to know what their cholesterol level is doing. And especially at this start of the new year, patients are like, hey, new year, new me, I want to get on a healthier kick. Let me go see what my numbers are and see if I can improve those. And so it's a good baseline to start to see, hey, where's my cholesterol? Let me start diet, exercise. Let's see if I can improve this. Let's see where my thyroid is. What can I do with these things? It's a great resource to have for yourself for information. And I think it helps people empower themselves to have better health in their own way, to be able to order whatever you want. And our phlebotomists are very well educated. You can come in and chat with them and say, hey, I'm having these symptoms. What do you recommend? But if you have insurance also, you can use our lab. You just need to make sure you have a lab order from your doctor if you want to use your insurance.
Thank you, Heather. Before we run out of time, I wanted to use the opportunity for you to send out the contact information to our listeners for maybe both the dermatology and the lab again.
Yeah, so for our Cache Valley Labs Direct, the address is 981 South Main. We're Suite 100. Our phone number is 435-213-3023, and we are in the same same complex where Domino's, Pizza Hut, Big Five, which is just north of the South Walmart. We're super easy, lots of parking, great location. And then for the dermatology office, once again, we are in Providence, just kind of around the corner from the lab, right by Macy's, and the address there is 517 West, 100 North, Suite 103, and the phone number there is 435-554-8442.
Thank you. Heather, it was a delight to have you here today. I can say that I learned a lot today, and there's some appointments coming up at probably both.
We're excited. How's that?
So that's awesome. So this is the Senior Moment Show. Again, we are sponsored by the Empowering Seniors Group. If you'd like to learn more about Empowering Seniors, you can do so online at empoweringseniors.info or email us at empoweringseniorscv@gmail.com. And CV stands for Cache Valley. We're at the end of our show. We hope you tune in again next week.